We are pleased to welcome Dr. K. Manoj Kumar, PharmD, an accomplished academician and wellness consultant. Sir is currently serving as an assistant professor at KVK College of Pharmacy, Hyderabad, where he has been actively contributing to the academic growth of students for past 5 years. With his strong foundation in pharmaceutical sciences, he is committed to nurturing future pharmacists with both theoretical knowledge and practical insights. In addition to his academic excellence, Sir has over 2 years of experience in the wellness industry, working with Warriors of Wellness Private Limited, WOW, as a wellness consultant. His expertise lies in applying a holistic approach to health management, where he has successfully guided 500 plus individuals in reversing lifestyle disorders such as obesity, PCOD, diabetes remission, and hormonal imbalances. By bridging his knowledge of modern pharmacy with holistic wellness practices, Sir has been able to make a meaningful impact both in academia and in the lives of people seeking healthier lifestyles. His dual expertise as a teacher and wellness consultant makes him a true inspiration in the field of health and wellness. Welcome, sir, to SYCCON S6 Day 19.
Yeah. So thank you. I think my voice is clear.
Yes, sir, your voice is clear.
Yeah. Yeah. So thank you for the welcome. So first of all, I want to thank you, Divya Darshini ma'am, for delivering wonderful session regarding gut health and skin health. As I know briefly about the gut, it is a second brain. So I learned few things. And the first session, Devi Priyamam regarding the mind, fuel, and yoga, are really wonderful sessions. So thank you once again for the sessions. So can I share my screen? Okay, so no issue. Yeah. So why these sessions are important for us, and why this doctor RX doctors community conducting this kind of sessions, like focusing on health regarding skin, gut, and my topic is diabetes. Why they are conducting? So I know everyone here from science background, like PharmD, BPharm, few from medical background. We are very well known about the science, causes, prevention, and treatment of diseases. Even though why this community conducting this kind of sessions, because I'm just telling from my experience. So whatever we learned and you are learning and we studied and you are studying, we'll try to implement mostly on the patients. But before that, we need to focus on our health. As a healthcare provider, if we are having any health issues, there is no meaning to read all those subjects, pharmacotherapeutics, pharmacology. First, my suggestion is first we need to focus on our health, our family, then we need to think about the patients. So that's why these people are conducting this kind of sessions to get awareness regarding the lifestyle issues and everything. Yeah. So coming to my topic, host, please help me to share my screen. Is anyone there?
Yes, sir, please give us few minutes.
Yeah. Okay. So today I'm going to discuss about the diabetes. So as everyone knows, the causes and the complications of diabetes. So coming to how the busy pharmacists are going to protect your health from the diabetes, I'm going to give brief information. So it's already 8:15. So you learned many things from the last two sessions. So I'm not going to take much of your time. I will try to finish as early as possible. Just give me 1 minute. I will share my screen.
Sir, can you please share your screen, sir?
Yes, I'm sharing. Give me a second.
Okay, sir. We'll be starting in another few minutes as there are few technical issues. Excuse me, sir. Please share your PPT to the number provided in the chat box, or we'll be sharing the screen.
My screen is visible now.
Yes, sir, it is visible.
Yeah, thank you. Yeah, sorry for the inconvenience. First time I'm doing in Teams. Yeah. So without any delay, let's jump into the actual subject. So as host mentioned, myself, Manoj Kumar, working as an full-time faculty in KVK College of Pharmacy, Hyderabad. So apart from my part of wellness field. Yeah. So what is diabetes? So చాలా మందికి sorry. So diabetes is different from other diseases. If you are getting heart related issues, only heart will be affected. Majority of the times heart will be affected. Any diseases related to nerves, our CNS and our nerves will be affected, and our liver related diseases, liver will be affected, and renal diseases, our kidney will be affected. Coming to diabetes, it will affect entire body. So like every organ in our body is affected by diabetes because of high glucose levels. Hyperglycemia is a bleeding cause of many diseases. So no one will die because of diabetes directly, but diabetes is a major root cause for blindness, heart failure, renal failure, and stroke related issues, amputations because of foot ulcers and dementia, infertility issues also. So these are the major issues we are getting because of diabetes. So that's why we need to take more control about the glucose. Yeah. So as everyone knows, India is the capital of diabetes. Diabetes capital of the world, India. Why? Because so almost till now 100 million people are suffering with this diabetes in India. And the worst thing is a few people don't know. They are already suffering with diabetes, but they're not diagnosed. So that is the most worsening part. Yeah. So types, coming to types, type 1 and type 2 majorly, and other remaining types like gestational diabetes. So coming to type 1 diabetes. So it is because of insulin dependent diabetes. So insulin is the hormone which carries glucose into the cells. So in type 1 diabetes, insulin will be less, there is a less production of insulin. And type 1 mostly because of autoimmune diseases and sometimes genetic related issues. Coming to type 2, it is because of insulin resistance. There is sufficient of insulin will be there, but there is no proper function. So type 2 diabetes is because of maximum 90% because of lifestyle issues and remaining 5 to 10% because of genetic related issues. So these are the basic types. Yeah. So today I'm going to discuss about mostly type 2 diabetes because this is because of lifestyle issues. Almost 90 to 90%, 95% in India adults are for those who diagnosed with diabetes comes under type 2 because this is completely related to lifestyle issues. So that's why I'm going to focus mostly about this type 2 diabetes. Yeah. So there are two reasons for getting type 2 diabetes. First one is insulin resistance, and next one hyperinsulinemia. So everyone mostly aware of this insulin resistance, but coming to hyperinsulinemia. So I'm going to give brief about this hyperinsulin condition. So what is the reason for getting insulin resistance? So these are the major six causes for getting any type of lifestyle disorders, not only diabetes, it related to thyroid, obesity in women, PCOS or infertility, and other hormonal issues. These are the six major causes. In that first one is poor diet. It is completely related to the nutrition part because our body will completely survive because of the food whatever we are giving. So majority of the people they will depend on junk food like low protein, high carbohydrates, high trans fats. So and next, exercise. Nowadays, everyone prefer like sedentary lifestyle. This work from home changed everything. So everyone sitting in the home, they're working, everything happening in the home itself. So no one wants to that physical activity. And the third one is stress. This is a major and major cause because starting from childhood, everyone facing this issue. Like children, they're stressed about school, homework, and those who are going to the college, they were stressed about marks, exams, and career, job. And those who are doing job, they are stressed about the career, financial stress, and family stress, future, everything. What will happen when we feel stress? There's a hormone for everything. Hormones plays a key role. If you are happy, happy hormones will produce. If you are stressed, stress hormones will produce. Cortisol is the stress hormone. It will disturb every hormone in our body. Actually, hormones in our body are like interlinked. Every hormone is interlinked with another hormone. So if there is abnormalities in any single hormone, there is a chance to disturb remaining hormones. Cortisol, majorly coming to cortisol, first it will disturb thyroid stimulating hormone, and next it will disturb conversion of T4 to T3. So there is a chance of getting thyroid related issues. Coming to men, it will directly impact on testosterone levels. And coming to women, it will impact on estrogen levels. So apart from this, it will protect a body to burn fat. So that's why those who are having stress, there is a chance of gaining weight. That is because of stress and poor sleep. Nowadays everyone feeling the sleep is just like a optional thing, but it's a mandatory thing. Why we need to get enough sleep? Because of our daily work, because of our daily stress, a few cells in our body will get damaged. What is the best thing in our bodies? It will heal itself, but the healing time is the when we are getting enough sleep. At that time, body will heal itself. But if you are not giving proper amount of sleep, that definitely there will be a cell damage, and it will leads to organ damage. Not immediately, but after some time. It will take some people 5 years and 10 years. So that's why sleep is very important, and everyone knows. So smoking and alcohol injurious to health. There is a label on the this bottle on the cigarette box. Even though people will consume, I don't know why. And genetics. So this will get from our family, right? So these are the major six causes for getting any type of lifestyle related issues. I'm not saying that everyone will have this all six categories. Someone will do physical activity. They will go to gym. They will perform some activities. Someone will don't have stress. Someone will get enough sleep. Someone will don't have any kind of bad habits, even though they are getting few lifestyle related issues. What is the major reason is, so majority of the people are getting poor nutrition. Some people don't have awareness. Some people will have awareness, but they will neglect. So the nutrition plays the key role in getting lifestyle related diseases. So coming to the insulin part, how insulin will produced and how it will work means the food, whatever we are taking, like carbohydrate, sugars, and sometimes protein food also. Uh, so whatever we are consuming, it will enter into the blood in the form of glucose, especially the carbohydrate and sugar. So after taking a meal, it will enter into the blood in the form of glucose. When glucose enters the blood, our pancreas will produces insulin hormone. So insulin will transport the glucose to the body parts. So few parts require insulin for the transport of glucose. Few parts doesn't require insulin to the transport of glucose. This is the basic physiology, the glucose and the insulin. But we are disturbing this normal phenomena by taking this kind of foods. Once observe this food, I collected from my clients. So the upper one will treat them as a food. Coming to lower one, this is not food. These are just snacks. We don't consider them as a food. Coming to our body require two types of nutrients, like macronutrients and micronutrients. Coming to macros, we require in larger quantities like fiber, fat, protein, and carbohydrates. Coming to micronutrients, vitamins and minerals. Once observe this plate. This first plate is idli. It's a complete carbohydrates and no good fats, no proper protein, no proper fat. It completely carbohydrate. This one also high carbohydrate, no good fats, no proper fat, protein, no proper fiber. So this also high carbohydrate, high carbohydrate. We are giving high carbohydrates and giving low protein, low fiber, low amounts of good fats. And coming to this is completely zero nutritional values. Completely contain high saturated fats and next high sugars. So this is a general eating pattern of most of the people. Yeah. So this is whenever I'm asking one person, generally clients will contact me. I will ask them a general question regarding how many times you will have food. They will say just I will have breakfast, lunch, dinner. Some people will say I will have only two meals. Like I will skip breakfast. Some people will skip dinner, and some people will replace rice with the rotis. But they will consider only breakfast, lunch, dinner as a food. But many people do mistakes. Like many people will have coffee. They start with the tea or coffee, and then they will go for breakfast, and they will have snacks in between breakfast and lunch. Some people will have again coffee or tea or coffee, and some people will have snacks in the evening after coming from the office or college. They will take snacks between lunch and dinner. And recent times, they started midnight cravings after dinner. Also, they will have some amount of milk, chocolates. In Hyderabad, that 4 a.m. biryani started. So even early mornings also they started eating. So what their perception is, we are having only 2 or 3 meals in a day, but unintentionally, unknowingly, they are taking almost 8 to 9 meals. So our body don't know whatever we are consuming, either we are taking idli or rice or biryani. The body language is different. It works by glucose. So if you are taking just small amount of coffee, it will produce as glucose. Breakfast, it will produce as glucose. Snack, just even single biscuit also give high amount of glucose. And lunch, again glucose. Evening snacks, it will produce glucose. Dinner, it will produce glucose. Night, midnight cravings, whatever you are eating, it will generate glucose. The problem is not with the glucose. The problem with the insulin. If blood getting glucose, pancreas need to produce insulin. They need to work tirelessly. Now, just from the morning, you have a coffee. So glucose entered into the blood, then insulin came and transported that glucose. Now insulin is try to take some rest. Meanwhile, you will have breakfast. Then again blood will get glucose, then pancreas will produce insulin. So then that insulin will transfer the glucose into the cell. Now insulin will think, now I will take rest. Again, you will give some snacks, then lunch, then snacks, then dinner. So this will become a burden for the insulin. Then after few years, the insulin will get resistance to the cell because the cells glucose. Now you gave 4 idlis, right? Just take an example. You have just 4 idlis. Body utilized just 2 idlis. Remaining idlis means the glucose. Body utilize glucose from the 2 idlis, and already excess glucose is there in the cell. But again, you have tea or coffee and you did lunch with high carbohydrate meal. Again, excess glucose is there. Insulin try to push maximum amount of glucose into the cell. Just take an example of a cell. It's having capacity of just 100 grams of glucose. But instead of 100, insulin try to push 200. But that is the maximum limit of a cell. Example, 200 grams of glucose is there, but body utilized just 50 grams of glucose. And next you will have a dinner, just 50 grams space is there. So again, insulin pushed 50 grams But what about remaining 150 grams? It will completely occupy in the blood. So then cells will won't accept insulin because insulin will carry glucose. Then the cells will get resistance towards insulin because of continuous eating, continuous glucose pump into the blood. So that is a major cause, and this will won't develop in just overnight or 1 month or 1 year. It will take some years to develop insulin resistance. If we neglect this condition, we'll get hyperglycemia. So this is the major leading cause of deaths. So not directly, indirectly. So this will causes heart attacks by atherosclerosis and renal failure because of nephron damage and directly nerve disorders. So these are the basic complications. In the meanwhile, while we are developing insulin resistance, body will give few signs, but we won't consider them. Not at all. Will just neglect everything. When we'll consider our health issues, when we get severe headaches, severe stomach pain, severe high fever, then only we consider we are suffering with something. Then we'll go to a doctor and we'll take some precautions. But this kind of drowsiness, so generally, if you are eating, we need to get more and more and more energy. But many people will get drowsiness after eating. So that is because of insulin resistance. And next, belly fat. If you are gaining weight, the belly fat is the starting sign. But nowadays, everyone feel belly fat is a normal thing. But that is not normal. That is a basic or first step that where our health is damaging. Belly fat is very important, and skin tags and confusion, sugar cravings. They will now some majority of the people now they will have a very high amount of food now. Just they will have a very lunch or biryani. After 1 or 2 hours, they will feel hungry because insulin is not transporting glucose properly. That's why the cell will create cravings towards sugars. That is because of insulin resistance and hyperpigmentation, the darkness around the neck and hair fall issues and joint related issues. But no one will care about this kind of issues because they are not major issues. They're just minor symptoms. We won't consider. But later few years, it will become there is a chance of getting organ damage because sometimes up to 75% damage. Body won't show any kind of symptoms. That is one of the major drawback. So don't neglect this kind of signs or symptoms. So these are the general symptoms and complications. Whatever we are learning from our textbook, urination, thirsty, polydipsia, polyphagia. So these are the things. And so complications. So as mentioned earlier, every organ in our body will be affected by hyperglycemia. So some parts will require insulin. So they are resistant. They won't allow glucose, but few organs in our body, they don't require insulin. They'll completely occupy that, completely overfilled with the glucose that directly damages the cells in that organ. So majorly the retina, diabetic retinopathy, and the foot ulcers and nephropathy, nephron damage will be there, and neurons. So neurons will be get affected. These are the basic complications of diabetes. So then what is the solution? So as Devi Priya ma'am and Divya Darshan ma'am already told about the nutrition part. So I'm going to brief about so this is new way of eating. So majority of the people in the South India, they will have a rice or roti with curries. But before taking that, we need to add fiber. So fiber is helpful for digestion and will treat constipation. And coming to diabetes, it will control glucose production. If you have just rice and curry, if that example, that rice contains 100 grams of glucose. If you are having that rice and curry, that 100 grams of glucose will produce at a time in our blood. So that will become a burden for insulin transport that glucose into the cell. But if you are adding fiber, protein, fats, then least carbohydrate, the fiber will helpful for gradual production of glucose. It will stop that burst production of glucose. That will help to regulate sugar, and it will reduces burden on the insulin and proteins from in our body. Every cell require protein, starting from hair, skin, muscle, enzymes, hormones, immune system like antibodies and DNA. Everything is made up of protein. If you are deficient in protein, definitely there is a chance of getting many kind of health issues, not immediately, in the future. And fats. Uh, Everyone feel that fats are bad for health. There are two types: good fats and bad fats. Regularly, I will take 10 to 15 reports from my clients. So almost 99% people are having vitamin D deficiency, but they will blame that sun. I'm not exposed to the sun. I'm not. So they're blaming the sun, but everyone forget about the vitamin D is a fat soluble vitamin, right? It won't soluble in the water. It will soluble in the fat. If you are not having enough amount of fats in our body, definitely you will get vitamin D deficiency, even though you're fully exposed to the sun. And next, carbs. So if you are healthy, you need to follow this order. First, you need to have fiber, fat, or protein. Then you need to go for carbohydrate if you are healthy. If you are pre-diabetic or diabetic, you need to restrict carbohydrates completely. And some people will say it's difficult to control carbohydrates because they're addicted to the rice, roti, and sugars. So if you're addicted, then start with fiber. So 50% fiber, 25% protein, 25% fats. Then your stomach almost will fill. Then you won't need to get carbohydrates again. So that's how you can prevent taking carbohydrates. And if you are diabetic or pre-diabetic, definitely you need to completely cut down carbohydrates for few, not for the lifetime, just for few months. So this is one way of eating. So including fiber, protein, fats, then carbohydrates. This is the eating order you need to follow to prevent from the diabetes or reversal of the diabetes. Yeah. So this is a new way of fasting. So because uh, the excess glucose in our body will store in the form of glycogen. If glycogen is not utilized, it will convert into fat. So why it is storing? For the good purpose. If you are not getting enough food in the timely manner, and sometimes someone will fast. So at that time, body will produces a stored fat. So it will convert again the glucose. That is the next process. So try to give fast. So as I mentioned earlier, so yeah, this is a basic eating pattern of many people. Try to break this pattern. If you want, if you want to add a sweet, someone is very like everyone likes sweets, ice creams, chocolates. If you are healthy, no need to restrict, but have at the time of meal only. No intermittent snacking. So try to avoid intermittent snacking. It will push burden on the insulin. There is a chance of getting insulin resistant. So there is a major difference between fasting and starvation. Starvation is not giving enough food. That is starvation. It will lead to other deficiency issues. Coming to fasting, try to include all the nutrients in your plate, like starting from the fiber, fat, protein, carbohydrates, micronutrients, and minerals, trace elements. Give it at a time. If you want to add sugar, sweets, add that time only. And then give bodies some time to digest and utilize that fats and proteins and stored energy. Then again, you start having meal. So that's how you can reduce insulin resistance. So try to avoid that intermittent snacking. Yeah. So this is a way. If you are diabetic or pre-diabetic, you need to follow this kind of eating habits, having 2 meals a day, and that 2 meals also contain all the nutrients. Try to add all the nutrients. If you are missing any one nutrient, also leads to major lifestyle related diseases in the future. That's why try to add maximum, and eating high amount or low amount is not the problem. Eating right amount, right quantity, right nutrients is a new way of eating. Try to add as many as nutrients in a single meal. then give some time, then have your next meal. So in the meanwhile, in the fasting state, body will utilize stored that carbohydrate, glucose or fat into energy conversion. That's why you can heal your body. Yeah. So try to include all the nutrients. So as I mentioned, almost 99% of Indians are having vitamin D deficiency and 80% will have vitamin B12 deficiency. So vitamin D, if you are vitamin D normal range in some laboratories will different. So 30 to 100 is the normal range. If you are having 20 or 25, you can have good fats and you can take from the food. But if you are very deficient, like if you are having 5 or 7 in the range, so definitely you need to include vitamin D supplementation. Same thing with the vitamin B12 especially. It will helpful for our neuron function and hormonal conversion, both vitamin D and B12. So if you are deficient, mostly vegetarians will get vitamin B12 deficiency because non-veg sources will have high amount of vitamin B12 and vegans, especially vegans, they won't include dairy products also. They will definitely get a deficiency of vitamin B12 once get tested. If you are just moderately or minor deficiency, you can include from the food. If you are very deficient or insufficiency, you need to consume from the outside. So remaining calcium, vitamin A, magnesium, and omega-3 fatty acid, especially whatever the oils you are using, they'll contain high amount of omega-6 fatty acids. So omega-6 will have inflammatory property and omega-3 is the anti-inflammatory property. So recent actual 4 is to 2 is the ratio. If you are having 4 omega-6, you need to have 2 omega-3. But recent studies show that omega-6 is 40, omega-3 is 1. 40 is to 1 ratio is there as per recent studies. So try to include omega-3 fatty acids like including non-veg sources or omega-3 supplement if you are vegan or vegetarian, because omega-3 will be high in fish, especially in the sea fish. Try to include as many as possible. So this is what it is completely called as balanced nutrition. So including both macronutrients and micronutrients. So this will helpful to prevent lifestyle related issues, not only diabetes. So we can prevent from obesity. Obesity and diabetes are both are interlinked because insulin is the hormone which stores the fat. The excess glucose will stores in the form of fat. So that's why insulin plays a key role in fat storaging. So that's why you need to consume the balance in nutrition starting from the fiber, fat, protein, and then least carbohydrates. Then include all these micronutrients like vitamins and minerals. They are very helpful. And minerals like zinc and this inositol, magnesium, selenium, they are helpful for chemical reactions, conversions of chemical reactions. So they're requiring very trace amount, but they're mandatory things. But many people will neglect. So now it won't show any effect, but in the future it will. You may develop lifestyle related issues and physical activity. Try to basic physical activity like a brisk walking 10 minutes, running, walking, mind, just cardio. So basic activity is important because it will reduces stress in our body. It will eliminate free radicals from our body and it will produce as happy hormones like serotonin, dopamine. Okay. So try to focus mostly on the physical activity and stress management, like Divya Priyam said about yoga. So try to include the stress. Many people, if you are employed, definitely you will get a stress from your office. So office stress will be taken by the office owner. You won't take that much of stress because cortisol is the major hormone. It will disturb every hormone in our body. So try to maintain that stress and try to include 7 to 8 hours minimum quality sleep, and that sleep must be between, try to go bed as early as possible, minimum at 10 to 12 will get quality sleep. So try to and many people are doing shift wise duties. That is a major drawback for developing all lifestyle related issues like obesity and diabetes. So try to maintain sleep because in while we're sleeping, melatonin and growth hormones will produce. If you are not giving enough sleep, you won't get melatonin and growth hormones. Definitely, there is no proper cell function. Okay, so try to include sleep in your calendar. So what next? First, go for checkup. So, so this is a habit. So if you want to take any point, any single point from these sessions, first go and check your biomarkers. So this is very helpful because internally body will damage, but we don't know, sometimes body will won't give any kind of signs and symptoms. If body gives also, sometimes we'll neglect. So try to get all the parameters. Coming to diabetes, HbA1c is the 3 months glucose average and fasting blood sugar levels. But the new thing is fasting insulin. Try to get this test as soon as possible. Fasting insulin. So if your insulin is in normal range, no issues. If your insulin in the high range, insulinemia, hyperinsulinemia, it will disturb every hormone in the body. In females, it will lower estrogen levels and will increases androgens. If a female body having high amount of insulin, there is a chance of getting high amount of androgens like testosterone. In it is reverts in males. There is a chance of getting high amount of estrogen in males. If you have high amount of insulin levels and get tested vitamin profiles like vitamin B12 and vitamin D and thyroid profile, because insulin will also affect on thyroid. So, and lipid profile like HDL and LDL and kidney profile, liver profile, and trace elements like copper and zinc. They are very important. And CRP, internal inflammation, C-reactive protein. If you are having high amount of refined oils, it will produces high amount of omega-6. Uh, omega-6 is an inflammatory agent. So you will get inflammation in your body that will be recognized or diagnosed by CRP test. So this is a basic information about not only diabetes. So it is completely related to lifestyle disorder. So try to include balanced nutrition. So that is the one thing you can take out from this session. So thank you, RX Doctors community, for giving me such a wonderful opportunity to share my experience. So if you have any queries. Yeah, pesticides and herbicides. Okay, I agree with that because nowadays everything is adulterated. They're adding chemicals, especially the coffee lovers, the tea lovers. We are getting milk from majority of the people getting from packets, right? So they will definitely 100% they will add preservatives. Okay, but one thing is body can detoxify. Body's best thing is body can detoxify chemicals. But if we are deficient in nutrition, it will leads to major drawback. Like now protein. Someone will say egg and chicken. They will inject injections to the chicks. But you are getting protein. If you are having enough protein, body will develop immunity. But if you are not having enough amount of protein, it will leads to deficiency or suppression of immune system. Body will won't work 100%. But if you are having a little amount of chemicals, just take an example. If you are getting chemical, but body can detoxify, liver is there. If your liver is healthy, it will take care of your chemicals. But try to include all the nutrients. So don't think much about the nutrition, but try to get some valid vendors. Still any questions? Yeah. So I think no one will have questions. So that's it. That's it from my end. So thank you for your valuable time. I hope I delivered the content. So if you have any queries, you can contact with our ex doctors community. They are in contact with me. So thank you. So back to the host.
Thank you, sir. On behalf of organizing team, I extend our sincere gratitude to Dr. K. Manoj Kumar sir for his insightful presentation on diabetes defense, practical tips for busy pharma professionals. Your talk highlighted simple yet powerful lifestyle and wellness strategies that can make a real difference in preventing and managing diabetes, especially for healthcare professionals with demanding schedules. Thank you, sir, for sharing your expertise, practical tips, and holistic approach with us today. Your guidance will surely inspire us to prioritize our health while we continue to care for others. Thank you once again, sir, for joining with us